Greetings. I'm Dr. Kristen Korenko, the Agency Senior Behavior Analyst for the Agency for Persons with Disabilities. I have the pleasure of chairing this particular presentation entitled Florida's Behavioral Health System for Children, Youth, and Young Adults, 2020 and Beyond. Myself, Ms. Lloyd, and Mary Schranker from DCF SAMHSA had the honor of presenting this presentation to all of you last year virtually when we were in the middle of COVID. Fortunately, we are coming to the tail end of COVID, and at the conclusion of such an unprecedented event, one tends to want to take a step back and take an inventory of best practices and lessons learned. And one thing that has rung true throughout the entire duration of this pandemic is the need for all of us to be able to collaborate and communicate effectively so that you, family members, you self-advocates, you fellow agency representatives, consumers, support coordinators, providers, and other interested parties know exactly how to access this information in order to gather and coordinate and plan what your son, daughter, ward needs. So I have the honor and the privilege of co-presenting with Ms. Alexandra Lloyd, who is the Behavioral Health Policy Analyst from the Agency for Healthcare Administration, or AHCA. I'm also co-presenting with Dr. Jennifer Fitzgerald from the Children's Behavioral Health Department of Children and Families Office of Substance Abuse and Mental Health, and she has been named the new Behavioral Health State Coordinator in the place of Miss Mary Schranker, who has moved on to other bigger and wonderful things. So just a general outline, if you will, of what we're going to cover. We're going to conduct an overview of what the behavioral health system looks like for children, youth, and young adults. It's not lost on all of us that we have many children in our state who really need these services and supports. And it's of interest to all of you to know that we work collaboratively rather than in competition with each other to make sure that any child that is eligible and deemed eligible to receive certain services and supports gets those services and supports for which they've been deemed eligible to receive. So there's three agencies that are really pioneering or piloting the plane, if you will, on this particular issue. I represent the Agency for Persons with Disabilities, APD. Ms. Lloyd will represent the AHCA, Agency for Healthcare Administration, and Dr. Fitzgerald will represent DCF, Department of Children and Families. We hope to provide many resources to you and also engage in a question and answer period that we will prompt offline and encourage all of you to submit your questions and answers to your proctor that may be assisting in the conference room in which you are viewing this particular presentation. But also at the conclusion of this, we will make our email addresses and contact information available to you should you feel the need to reach out to us and ask these questions. Okay, so in terms of looking at the actual system that functions within the state of Florida, we have many different entities, managing entities, healthcare plans, and also state agencies that incorporate or are all involved in moving forward and providing these necessary services and supports. We stress community-based settings because we want to move away from institutionalization and prevent re-institutionalization, and looking at residential settings that are appropriate, that are family-based. There's a variety of different avenues through which you could access to have these services and supports provided. We also want to acknowledge that there are many, many legislative efforts that have occurred over the last 2 legislative sessions that have also been prompted by not only the COVID contingencies, but the need to continue to promote community inclusion and least restrictive intervention strategies. We want to make sure that you have access to what our mission is, as well as our website. Now, if you're looking at this, you're saying, okay, well, I know the web address and I know in general where to go and find that. And if you don't, this particular information will be made available to you at the conclusion of the training. But just in general, when we're talking about the mission of the Agency for Persons with Disabilities, we want to focus on providing those services and supports for which a person is eligible to receive. We have certain eligibility criteria that includes autism, it includes spina bifida, intellectual disability, Phelan-McDermott syndrome, Prader-Willi. And in terms of looking at the impact of those particular disabilities and what it actually does to that child or to that young adult, that is figured into our eligibility criterion. So it's not just a matter of somebody having a specific diagnosis of a developmental disability, but the impact and the effect that that particular disability has on that person's level of independence and overall well-being and functioning. We also have the link there that you can use to access the application information. Because we look at developmental disabilities, the definition specifically of, well, what does it mean for a child to have a developmental disability? What that means is it has to be prevalent within the first 18 years or chronological years of their life. And there's certain criteria that get evaluated and included or excluded based upon what a child is experiencing. So one of the questions that we've been often asked is, what do I do if I'm in crisis? Okay, I have a situation that's going on. Again, we've had these experiences over the last year. They've probably been amped up and very much heightened as a result of COVID contingencies. But where do I go? What do I do when I'm potentially in a homeless situation? Or that person, that child is exhibiting life-threatening behaviors? What if I do if I'm trying to get access to services and they're engaging in these behaviors and my school, their teacher says that they have the diagnosis, they're on the spectrum per se, or they have a diagnosis of cerebral palsy, okay? The first go-to is the person in the region. And we have several regions around the state of Florida. Again, you can find that information on your website. In fact, I believe that members from the central region are in the audience today that may be able to help guide you if you have any questions with regard to whom you need to reach out to access the person to go to in your home regions in terms of, how do I fill this paperwork out? What exactly does it mean to be in a crisis situation? Crisis is subjective. What may be a crisis to me may be different than what a crisis to you is. And I know as a parent, you're sitting there and you're thinking, if something is going on with my child, that's a crisis. So in order to help clarify for you what specifically those criteria are on that particular list, the actual reference is listed here as well. And the person in the audience that can help guide you to that will also point you in the right direction as to where to find that application and those inclusionary criteria. One of the things that we've done over the last year is we've listened. Listen more, talk less. And we've listened to many families, many providers, many self-advocates. We've observed challenging behaviors with not only kiddos that we serve, but also young adults and adults that are young at heart, okay? In terms of looking at what our stakeholders and consumers need, we pivoted. We provided an exorbitant amount of resource material also on our website. Everything from what is COVID to where can I get a vaccine, basically, and everything in between. I encourage you to, if you haven't recently looked at our website for that information, I encourage you to do so. There has been a phenomenal amount of information there. Also including mental health issues with regard to, okay, my child was progressing very well on their verbal behavior training, and then all of a sudden their progress took a dip. Well, why? Well, quite honestly, there might have been some things going on. It could very well be the manner in which that training or that educational piece has been provided. I hear countless examples of parents who are, they're frustrated because what ends up happening is they are used to providing the training in a classroom or in a clinic setting. And they're going back and forth with their trainer. It could be a registered behavior technician, RBT, or speech and language pathologist, going back and forth and teaching them PECs, right? It's one thing to be sitting in a room where we're not physically distant. It's a whole nother thing to be discussing and communicating with a child in a very similar environment and format as this, where I've heard from trainers and heard from family members, they'll sit there for 2 minutes, they'll take the tablet and toss it across the room, right? So in terms of looking at how you can remedy that situation, we do have a number of resources that are available to you. Social stories is a big thing too. So instead of just giving you examples of social stories that have already been written, we also teach you how to write your own social story. Okay, so there are those references and resource information pieces there. And then finally, one particular resource that I absolutely love, and that's a hard press for me to say because I'm a Seminole and this came from University of Miami, okay? Go Noles. But anyway, this last resource on this particular slide comes from a group of professionals from the University of Miami, and they have so many different examples of coping strategies and intervention strategies that you, the families, and the caretakers can take advantage of. In addition, in terms of looking at behavioral health, one of the questions that's prompted is, well, I know my child, I know my young adult has intellectual disability or has a diagnosis of cerebral palsy, but they also have ADHD, attention deficit hyperactivity disorder, or they may also have schizoaffective disorder. They may also have childhood schizophrenic episodes. Where do I go for information in that? There is a population and there is a group of resources that we've also included on our page for those individuals who have what's referred to as a dual diagnosis. And let me explain. In some environments, a dual diagnosis is looked upon as a person who has a mental health issue or mental illness and also a substance abuse disorder. This particular environment or focus is a person who has a developmental disability and also a mental, psychiatric, or psychological disorder. And there are many resources available to you on that page. We also have a mental health tab that you can click on, and there are resources there for self-calming, how to say good job 50 ways, how to really be supportive of your team members. If you're in a working environment, let's say you've been working virtually for over a year now and you're migrating back to the office, how you need to take your time and move through the transition and fade back into that environment. What does it do to your son, daughter, or if you were a guardian, you're the caretaker? Separation anxiety, looking at stress, looking at trauma. Trauma-informed care is also an issue that we have been zeroing in on. And rather saying, well, what did you do? You pose the question, well, what happened to you? When you pose that question, you pivot and you use different wording. You'll be surprised at the response. Those individuals that can't really articulate, they can't sit down perhaps and have this conversation back and forth. Actions speak louder than words. Their behaviors speak volumes. You just have to be observant and patient and take it in and see exactly what your son or daughter, and your particular person that you are the caretaker of shows you. If you are a self-advocate, there's also connections there that you can make in terms of accessing this information for self-advocates. There is a whole host of self-advocate networks that we've been partnering with in order to collaborate. I call it catch and release. You collaborate and you catch this information, you catch this resource information, and then you release it, you share it. We do so after we've properly vetted these resources and made sure that if I had a child with a developmental disability, this is something that I would want to be able to share, either with another family member or incorporate it within my own environment. Okay. So with that being said, I just want to say thank you very much for your attention and your patience today. I am so sorry that we can't be with you today, but at this particular point in time, I'm going to tag in my co-presenter, Miss Alexa Lloyd. Alexa?
Good afternoon. My name is Alexandria Lloyd, and I'm a policy analyst in the Behavioral Health Unit at the Agency for Healthcare Administration. I have a few topics that I wanted to go over with you today. So the first topic is the organization of Florida Medicaid. So Florida Medicaid has two delivery systems for services. About 80% of Medicaid recipients receive their benefits from the first delivery system, which is called managed care. This means that the recipient receives coverage from a health plan, such as Stay Well, Sunshine, etc. The second delivery system is often called straight Medicaid, or also fee-for-service, and this has about 20% of Medicaid recipients enrolled in that. The next topic I wanted to go over with you is the comprehensive array of behavioral health services that are available to recipients and that are covered by Florida Medicaid. Florida Medicaid covers and creates policies and procedures for several behavioral health services, such as behavioral health assessment services, community support services, behavioral health intervention services, therapy services, and many others. Under the Early and Periodic Screening, Diagnostic, and Treatment benefit, Florida Medicaid is required to cover services for eligible recipients under the age of 21, if medically necessary, to treat a mental or a physical illness. Florida Medicaid also covers behavioral health telemedicine services. Florida Medicaid covers behavioral health evaluation, diagnostic, and treatment recommendation services through telemedicine. Florida Medicaid reimburses for these services delivered via telemedicine at the same rate detailed in the Community Behavioral Health Fee Schedule. Additionally, all services delivered via telemedicine must be conducted in accordance with the agency's telemedicine rule. In addition to the rule, the agency has allowed new telemedicine flexibilities for the COVID-19 state of emergency. The agency has expanded services provided through telemedicine via live two-way communication through the fee-for-service delivery system for services to include treatment services if medically necessary. The agency has also lifted the prior authorization requirement and removed service limits for behavioral health services under the state of emergency. For more information on these flexibilities, the AHCA public website has a page dedicated to all the Medicaid provider alerts issued during the state of emergency. This leads me to my final topic, which is resources. For assistance with managed care, please reach out directly to your healthcare plan. For assistance with fee-for-service or for general questions regarding Medicaid, you can contact the Medicaid helpline, and that is a specific phone number, and I can share that with you. It's 1-877-254-1055. Additionally, the ACA public website has many helpful resources for both providers and also recipients. The agency's public website features a COVID-19 alerts page that has the most current updated information regarding services and flexibilities under the state of emergency. The agency's statewide managed care website also has many resources, such as all the health plans by region, Medicaid and health plan contact lists, recipient support information, a portal to submit both questions and also complaints, and also a place to go where you can sign up for program updates. And that concludes my presentation. Thank you so much for your time. And so now I will turn it over to Dr. Fitzgerald of DCF.
Hello, welcome back. We are joined by two Department of Children and Family team members in order to help add information to this overall presentation and provide additional resources for you to take with you at the conclusion of this presentation and get your needs met. So we are joined today by Dr. Jennifer Fitzgerald. Jen, would you like to go ahead and introduce yourself very quickly for the group?
Sure. Thank you so much, Dr. Karinko, and welcome everyone. My name is Dr. Jennifer Fitzgerald. I work with the Florida Department of Children and Families as the statewide children's mental health coordinator. We're very excited that you're here today, and as Dr. Karinko shared, we'll be providing you with an overview of the behavioral health or children's mental health lens throughout the state of Florida. Dr. Karinko, could you flip the slide, please?
Sure. Before I do that, I just want to introduce our other team member who has graciously joined us today, and that's Miss Robin Gast. Robin, would you like to go ahead and say a few words before we press on with the presentation, please?
Sure. Thank you so much for having me. It's a pleasure to be here with you all today. So my name is Robin Gass. I am a licensed clinical social worker. I've been working at DCF CMH headquarters going on 5 years in December. I am the statewide coordinator of the Community Action Treatment Teams, also known as CAT teams. Thank you.
Welcome. Welcome, Robin, and welcome, Dr. Fitzgerald. And with that, I'm going to go ahead and go off camera, and I will press on.
Thank you so much, Dr. Karinko, and thank you, Robin, also for joining this training. So again, we're going to start. My name is Dr. Jennifer Fitzgerald with the Children's Mental Health Unit with the Florida Department of Children and Families. So we want to start first with the structure of the state of Florida and how that looks as it relates to services being provided and the agencies that come in connection or work collectively with us. So Florida uses a variety of state agencies to include the Agency for Persons with Disabilities, the Department of Children and Families, the Department of Education, the Agency for Persons with Disabilities, Children's Medical Services through the Department of Health, as well as the Department of Juvenile Justice. Sometimes we use the Department of Corrections if we have a kiddo that may age out of the system. For example, he or she may be 17, turning 18, may get into some challenges in life. So we would pull in the Department of Corrections at that point because the child has now become a legal adult. The funding for our children's behavioral health or mental health services could include your own private health insurance through your employer. It could include Florida Medicaid, which is our Medicaid managed care plans. It can also include private funding. For example, if you have a child or you're working with a child that is not a U.S. citizen, or there are barriers to accessing the Florida Medicaid system, there are funds that the Department of Children and Families has to support and provide assistance to the family. Moving forward, in 2011, the Agency for Healthcare Administration, most of you all may know that as Florida Medicaid, privatized Medicaid and contracted out to a number of Medicaid managed care plans to include Humana, to include Sunshine Health, to include WellCare, to include Centene, So we have a number of plans that work as Florida Medicaid by contract to offer and support your child or the consumer that you're working with in accessing services and working with you all to ensure that the appropriate services are in place to support the child's mental or behavioral health needs. We've listed here on this slide where you can locate the health plans, and that's www.fdhc.state.fl.us. So I would encourage everyone to take a look at that and become more familiar with all the resources that the Medicaid Managed Care plans can offer. And this is go ahead to the next slide. So the Florida Department of Children and Families, similar to the Agency for Healthcare Administration, contracts out a number of services through what we call managing entities. We have 7 managing entities across the state of Florida that serve a certain geographical area. For example, in the Suncoast region, we have Central Florida Behavioral Health Network. We have a number of contracts that move through the managing entities to provide for children's behavioral health, adult substance abuse, and children's substance abuse. And we have included the website here if you'd like to learn more about the programs and resources that all of our managing entities who contract with the Department of Children and Families offer. And they're a wealth of information as they do manage the contracts for the state. Next slide. Here's a breakout on if you look at the state of Florida map, all of our managing entities around the state. And as I described, the Suncoast region, they serve 14 counties to include all the way south, last exit before Alligator Alley, all the way up to Pasco County. So these are, this is the list, and you can go to the next slide. So in order to access any behavioral health services for a child, a consumer, an adult, each state agency has the allocation and the specified population by which the allocation of dollars are moving through the state. So this slide talks about how we define that population. When we're talking about kids, we're looking at psychiatric diagnosis. We may be looking to Dr. Karinko and her team with the Agency for Persons with Disabilities if a child has autism or any significant impairment that may be causing the kiddo challenges within the school, within the family, or in the community population. So this kind of describes how our programs are funded. So it's very specific to the population that we are serving. Next slide. And this, again, as I was just describing, these are kiddos that may have severe emotional disturbance. They may have an individual education plan, also known as an IEP, through the school district. It could be a kiddo that has co-occurring both mental health and substance abuse issues, or it could be a person at risk of a significant mental health issue or or a substance abuse issue. Next slide. So this is our state of Florida's behavioral health services array. So although this presentation is focusing specifically on children and later or adolescents and young adults, I went ahead and included the 4 bullet points. So we always want to look at first prevention. What can we do to divert a child from moving into a higher level of care? Do we need to refer them to outpatient services, identify a psychiatrist, locate a community mental health therapist? What can the school districts do? Can we link the family or the consumer to any peer support group? And if it continues to escalate and there are significant issues, we may need to look, for example, at a Baker Act. And a Baker Act is an involuntary placement into a short-term psychiatric stabilization program, also known as a CSU. Also, for children, we have the Psychiatric Inpatient Residential Program, also known as SIP, which is a short-term residential program. Okay, next slide. These are the different, as I was just describing, the different levels of services. We always want to start with the least restrictive when we're working with kiddos, adolescents, young adults, or even adults. We want to see what we can do within our community settings, within the family systems, to support this child or young adult to reduce any hospitalization or inpatient stabilization. So we may have therapeutic foster care for kids that are in the dependency system. This is a program that's designed for 1 or 2 kiddos where they receive counseling 2 to 3 times per week, upwards of 4 times a week. Okay, next slide. We're going to move forward to the community action team, and this is Robin. Robin, I'll turn this one over to you.
Hey, thank you. So just to really quickly go over the eligibility criteria for the community action treatment teams, also known as CAT teams, I'll also ensure I just do a quick little overview of what CAT teams are. So to be eligible for services, individuals aged 11 up to 21 must have a mental health diagnosis or co-occurring substance use diagnosis with one or more of the following accompanying characteristics. So the individual is at risk for out-of-home placement, as demonstrated by repeated failures at less intensive levels of care. The individual has had 2 or more periods of hospitalizations or repeated failures. The individual has had involvement with Department of Juvenile Justice or multiple episodes involving law enforcement, or the individual has poor academic performance or suspensions. Children younger than 11 with a mental health diagnosis or co-occurring substance use diagnosis may be candidates if they meet 2 or more of the aforementioned characteristics. And one thing that's important to note is that individuals residing in therapeutic placements, such as hospitals, residential treatment centers, therapeutic group homes, and therapeutic foster homes, and also those receiving day treatment services, are not eligible to receive CAT services. And just to give you an idea of just the great work that CAT teams really try to achieve. So some of the program goals are to strengthen the family and support systems for youth and young adults to assist them to live successfully in the community. CAT teams is one of the most intensive community-based services out there for young people. Improve school-related outcomes, decrease out-of-home placements, improve family and youth functioning, decrease substance use and abuse, decrease psychiatric hospitalizations, transition into age-appropriate services, and increase health and wellness. And one thing I wanted to mention very quickly is just the overall CAT model. The CAT model, for me, is one of the most important things for me to be able to continue to do, is just to make sure that the CAT model stays intact. So based on a family-centered approach, which really means, meeting the family where they are at, this flexibility and service delivery is intended to promote a whatever it takes approach to assisting youth and their families to achieve their goals. Assisting parents and caregivers to obtain services and supports in a comfortable manner that are culturally and linguistically appropriate. And the CAT model must include the provision of information and education about how to obtain services and supports, assistance with referrals when needed, work collaboratively to deliver behavioral health services with integration of primary care and broadening the family's expectations and potential, coordinating with other community service providers when necessary. It's extremely important that CAT teams really have a great working relationship with other providers, assist the family in developing or strengthening their natural support system as well. So I just wanted to provide a little bit of an overview for CAT, just so you can get a taste and a feel for what CAT teams really try to achieve when they're working with youth and families. Thank you.
Thank you, Robin. In conjunction with the CAT team, the state of Florida also offers the Family Intensive Treatment Program, also known as the FIT team or FIT service. And this is a program that's designed to support families who have encountered or had a hiccup or a challenge with substance abuse, and their kiddos are at risk of being removed. So, for example, child protection may be involved, but the goal is to provide that family support, the parents' education, resources, and provide the safety of the child as always first and paramount. Next slide. So the mobile response teams in the state of Florida are facilitated or overseen, similar to Robin with the CAT team, by Twyla Jowers. Our mobile response teams were designed to support our families and community partners when they're working with a high-risk child or a young adult who may be experiencing significant behavioral health or mental health crises. For example, if your child or a constituent or consumer that you're working with appears to be meeting the criteria for a Baker Act, you could always reach out to the mobile response team. A law enforcement and a licensed practitioner or three of the above will respond to your home and provide support to try to divert the young adult or child from involuntary hospitalization. What the state has learned is that a number of young folks have had numerous Baker Acts, and we know that that could be detrimental to their development and their well-being. Next slide. The Department of Children and Families also has the ROSC, or Recovery Oriented System of Care. And as Robin was describing, this is a family-centered approach that is guided not only by the family, but by the consumer, the child. We want to look at how can we help you, tell us what your needs are, so that we as professionals can just be a spoke on that wheel to connect you and your family to obtaining and accessing the services and resources that you need. We know that families are the experts. Families know their children and their partners best, and we need to rely upon you all as the partner or the spearheader or the leader driving a recovery-oriented system of care versus us as professionals telling you all what decisions you should make based on our experience as professionals. We want to put it back in your lap. We want you to make that choice. We want you to drive that choice and tell us what you need. Next slide. And these are the different types of recovery-oriented systems of care. Again, we've talked about the adult substance abuse as it relates to the needs of the family or that consumer. With children, again, it's that having that child's voice at the table, listening to what he or she's needs are. For example, if a child's been in 3 psychiatric residential treatment programs and not one person has spoken to the child and they're 16 or 17, it's very, very important to have their voice at the table, to let them be heard, to let the professionals and the team members hear exactly what the child is looking for in their future, because this is their life, and we want them to help us guide them and steer them on the right trajectory. Next slide. Okay, Dr. Karinko, do you have any questions? Or are there any comments from your side?
Well, I think, first of all, thank you both, Dr. Fitzgerald, and thank you, Robin. We so appreciate your time and attention and attendance and contribution to this particular presentation. I think the important point, perhaps, there's a few. Number one, we represent not only DCF, APD, but ACA, and we want to make sure that those of you that are sitting in the audience, whether you are a caretaker, a family member, a parent, a legal representative, a consumer self-advocate, or a provider, we want all of you to know that united, we are together. We are moving forward together in order to pair and collaborate all of our services and supports that each of our agencies represent, so that at the end of the day, the services and supports that need to get to you get to you. And we know that there are more times than not that we have miles to go before we sleep. But I got to tell you, I've worked alongside of all of the young women who have graciously agreed to co-present with me today to bring you this information. And I know that we are all equally committed to moving forward. There's a lot of exciting developments that are coming down. We've seen so many changes as a result of legislation, as well as what COVID contingencies have put in front of us. We know that many of you are looking at this pandemic and just incredibly happy and relieved that it is coming to an end. We also know and recognize and respect the fact that many of you have had significant loss. And with that, I still say to you, we are making progress. We have sources and resources for you to access in the event you need a professional or you need some direction. So don't hesitate to reach out to any of us. And with that, I think I'm going to go ahead and just tag you back in, Dr. Fitzgerald or Robin. Do you have any closing comments at this time?
Well, I do
Hi,
want to
Doc.
mention.
Go ahead, Robin. I'm sorry.
Oh, no, it was fine. I was thinking in retrospect, I should have mentioned that there are 41 CAT teams across the state, and there is county-wide coverage. So every county in the state of Florida does have CAT coverage. So I meant to let everyone know that too.
Okay. Thank you, Robin. Dr. Fitzgerald.
Thank you, Dr. Karinko, and thank you, Robin, for reminding folks or sharing with folks about the CAP coverage throughout our state and every county. I just want to thank everyone, as Dr. Karinko did, and know that we are all here for you. We know this has been a challenging year. We know the stressors between family, work, our whole world has changed in the last year and a half. So we thank you so much for being here, being present, whether you're at home or you're in person. We are here for you. And thank you so much for joining this webinar. Have a wonderful evening or day or evening.
Thank you. And I echo that sentiment. Thank you very much for joining. I realize that you have room monitors that will moderate, that will also pass on any questions or comments that you have for those of us that presented today. We will take those comments and questions and address them as quickly as we possibly can. So again, thank you so much for joining us. Have a wonderful day. Enjoy the rest of the conference, and we hope to see you in 3 dimensions next year at the next Family Cafe. Take care, everybody. Thank you.